Welcome back to Achieving Unlimited Health. In our last episode, Dr. Cima explains how detoxifying the body can unlock new energy and clarity. Today, we're exploring the next layer of that journey: hormones. They're the body's messengers, quickly shaping everything from our metabolism and mood to sleep, motivation, and longevity. So let's dive in. Hi, Dr. Cima. I'm so happy to see you.
Happy to see you too, Layla.
Awesome. I'm excited for this episode. I've mentioned previously, I've had some hormonal issues myself. So this is super important information. So let's dive in. So Dr. Cima, when did you first realize that so many of your patients' struggles were actually connected, not just to diet or toxins, but to hormones?
A long time ago, back in 1960, 68, I really got involved with the endocrine system. And I really said that's what I really wanted to be. I was trying to change my major from pre-vet to more of an endocrine background because I thought that was going to be the way of the future, which obviously it's been, for a long period of time. So when I first got involved with endocrinology, it said that was a system of function in the whole entire body. And then within a few years after that, I went to chiropractic school. They said, no, the nervous system is the system of function in the body. And they were kind of both right because it's the neuroendocrine axis, which basically controls the whole body from reproduction to digestion to producing energy to repairing and rebuilding the body and all the rest. So I saw even back then it was something that was really important, being well versed with the nervous system now, being a chiropractic physician, and also having a pretty good background, a really good understanding of the endocrine system and how you can help improve that with diet and other types of therapies and methods and modalities. And so I thought that would be a really good thing to study and put in line with my nutrition. And that's so the part of the blood chemistry analysis that we do involves a lot of the endocrine functions. So we look at a lot of the hormones from the female reproductive axis to the thyroid, to the insulin from the pancreas and so on and so forth. So we're always looking to see exactly what part of the endocrine system is malfunctioning as well. And then through proper diet and nutrition, you can help improve that. But in today's world, it's actually gone the exact opposite way. It's now they use a lot of hormone replacement therapy, HRT. Or if you have a thyroid problem, especially if you're a female, they're going to put you on, some kind of synthetic thyroid medication. And the same thing with the insulin nowadays with the diabetics. And you see now they're even using a lot of the diabetic medication for weight loss. So it's kind of getting crazy, but that's what's going on. But you do have a choice. And in fact, what you should think about is that you're always going to have to figure out how to balance your endocrine system. It's very important, especially with women. Once they go through menopause, it's a tough time for a lot of women. And they want to look for a quick fix, and sometimes there isn't any. So they'll resort to HRT. And if depending on what method they use, whether it's pellets or it's cream or it's a shot or whatever it is, it's going to take some time to try to figure out what's going to work and what's not going to work. But more importantly, you still have to support those glands or organs that produce those hormones. If you're talking about the female hormones, you got to think about, the ovaries. You have to think about the pituitary, the hypothalamus, the adrenals. And so you have to look at a lot of the different other glands and organs that support the function of those glands so that they can produce those hormones. So as you get older, you don't have to just be totally concerned about just hormone replacement therapy. So I think it would be a combination for a lot of people. But that was when I started back, as far as getting involved with nutrition. So it was even before thinking about toxicity. The old diet was always important to me. But when I looked at everything and I started to see, even in today's world, it's really tough because we said 74% of the population in the United States is overweight, 40+% is obese, and 14 or 15% is morbidly obese. So those things kind of spell even more trouble because the more obese or the more overweight you become, the more unhealthy your hormonal endocrine system starts to develop. And so as that occurs, what will happen is that then you're going to go into the third phase that we talked about, where literally you start altering your hormones. Your diet was wrong to begin with. Okay, so the body started to, become very, very toxic, and now the toxicity of the body is destroying the endocrine system, the system of function. So, and then each particular person is in a different phase. You could be, you're going to go through those three phases, but if you don't change your diet, you're still going to be impacted with your nutrition. If you don't change the way you do things, even with exercise, especially with the sex hormones, exercise, weight training is really important, because the more muscle you put on your body, whether you're a male or a female, the greater amount of hormonal production you have to have in order to do that. So it's a combination of some physical factors too that you can do to help enhance hormonal improvement as you become, let's say, as you get into your 50s and 60s and 70s. It becomes more important even, at that point, because now you're talking about problems with your bones and problems with, there'll be all kinds of endocrine malfunctions in the body that'll create all kinds of diseases and problems as far as that goes. And so it's like, if you look at the whole scheme, it's like the goal is really to try to make sure your hormones are in balance. Because like you said before, it's like they cause you to sleep or not sleep. They if they're created in proper amounts, you can be in like really happy states all the time, because it does affect your emotions. So the endocrine system, in fact, when you have imbalances in the endocrine system, we used to call them physiologic storms that create a lot of mental emotional duress in the body. Like, you may think that you may not even know, like, I don't feel good. I don't emotionally, I just don't feel good. What's bothering me? Nothing that I know of. No big thing there, but people, they don't realize that that's possibly being caused by a lot of biochemical imbalances due to hormones. So it's a really, really big, especially in today's world. Like I said, it's really, really big. And
Absolutely. And you've been helping patients for over 5 decades at this point now, right? So when you first started, how did the medical community view hormones compared to how you approach them now?
well, they still do the same thing. They still want to do the hormone replacement therapy and the insulin and all this. And they don't really, let's say, they don't really discuss, like, diet as far as something that'd be really important, and exercise, and taking nutritional supplementation that can help repair, rebuild the glands and organs in the body. So, let's put it this way. You were born with all these organs and glands, and your body produced those organs and glands. So how that makes the body heals the body. Endocrine system has a very, very important role in all different functions. If you don't take those glands and organs that produce those hormones, give them what they need, eventually they start to break down, have a run away. It's when they say about a woman, okay, she's menopause. Well, it's a shift in hormones. But if you get that shift balance with the estrogen, progesterone, testosterone, everything else like that in proper alignment, you won't feel the effects of going through that kind of a scenario. And so you may not suffer the problems with night sweats and gaining weight, and, not feeling, you don't feel emotionally the way you used to feel before, and you can't sleep and all the rest of that. Or you can, like I said, with diet and the proper supplementation, you can modify that. But you're going to have to do something. And it's not just like with the hormones, because they'll kind of like put a Band-Aid on the situation. But the reality is that if you don't support the glands and organs that create those hormones, it's going to get worse. And by the way, by taking the hormones, you make the glands and organs worse. It's kind of like a double-edged sword, because the more you give the body the hormone, the body doesn't have to produce it. So if you give the body a synthetic thyroxine, okay, the thyroid will go, oh, my thyroid levels are pretty good. So I don't have to sit back and wait around and eat potato chips and bonbons like everybody else. That doesn't work. So that's what happens. So it's like that double-edged sword. So you should do something to help prevent that or stave that off. And doctors should even recommend that to their patients, but they don't. In today's world, it's very medically oriented. It's like drugs and surgery, drugs and surgery, drugs and surgery, which at some point you sometimes do need that. But I've been around this area and all the old patients and stuff, and listening to what their doctors have done with them and to them and all the rest. And you better start thinking about it, listening to the doctor within, and go with what you feel, as opposed to like if a doctor says, "Oh, just do this," you do it. Because I watch people, they do it and there's no results. Or worse yet, it's complicated and severe pain. And on top of that, they don't have an answer. A lot of times patients will come in and say, I said, well, what does the doctor say? They go, we don't know. They're giving us this, they're giving us that, they're giving us this. And it's like, and then that further confuses the patient, because they think that this is a death sentence. Like, nobody knows what's going on with it. So it kind of gets to, to that particular point. So they play with their emotional state.
Mm-hmm.
That's just as detrimental as everything else out there.
Mm-hmm.
So and
I was going to say, and I know that you often explain that poor nutrition leads to toxicity. So, and toxicity leads to a hormonal imbalance, what you call the third stage. So,
right.
Can you walk us through how those first two stages really set the foundation for hormone problems later in life?
Oh yeah, no, that's a perfect question. Yeah, usually, in today's world, it's about 100 times worse. But you wind up, if your parents, when you're born, you're a child, don't really watch what you're eating. In today's world, it's very simple to like go out and buy things and just prepackaged or whatever, and utilize that stuff, and then kids can turn around and eat whatever it is that they want, whether it's cake or cookies or pie or pastry or whatever it is, or they have a type of diet where they just, well, I don't want to eat this because I don't like it, and the parents allow them to do that. So eventually, this child starts to grow up with a very unhealthy diet. And like my father always said, he goes, if you want your body to be like a piece of junk, eat junk, and that's what it's going to be. You might as well buy your car from a junkyard. So, and that always hit home. And I realized that you just can't go out and start eating cake and cookies and all the things that teenagers do, and even the fast foods and everything. It's satisfying, from a taste perspective. But the reality is that nutritional wise, well, your body needs the most building blocks and the most solid foundation. It doesn't even get there. So you start to deplete the body of vitamins and minerals because it's not the foods. I mean, back in the 60s, they were saying that foods grown in the 40s, okay, where you had to eat almost twice the amount of food to get the same amount of vitamins and minerals. And that was, 60, 70 years ago. So it's 10 times worse now. And so these kids start going that particular way, or they go like, you have again, a lot of different diets out there. And people like, start to look at their kidneys kind of gaining weight. So they said, okay, that's enough with the cake and the cookies. And we're not going to eat anything with fat in there. And you're not going to eat meat. And the kid may need the meat. So it's something where the diet is just improper. And so as the kid starts going into his teenage years, he starts to see different changes in his body weight. He starts to gain a lot more weight, doesn't know why he's gaining the weight. And then they start to go on different kinds of crazy diets. And that's what happens. So you don't even know what the right diet is. And in today's world, they trick you constantly. You put on the TV and there's Joe Schmo with his like diet for everybody. And then it's like, it's if I got involved with nutrition today, Layla, I couldn't be able to figure it out. This is so confusing. This, expert says this, another expert says that, another expert says this. And after a while, you just don't know who's right or who's wrong. So you go on you might say, well, I want to be a vegetarian. It might be the worst thing for you. Or you might turn around and say, well, I want to be a ketogenic. It might be the worst thing for you because you just listened to somebody and you just like kind of flowing with everybody's thoughts and you're going to just see what happens. And if you don't do it systematically and logically, you're never going to get past that point. So these kids start going into their late teenage years, early 20s, and now they're starting to have problems with weight. and they don't know what to do. They're reading this, they're reading that. They tell them to do this. And like I said, in today's world, it's got to be 20 times worse. Facebook and all the ads and everything else like that. So, trying to manipulate or kind of weave yourself through all this mess, you're not going to do it. And so you're going to need somebody that's going to need to help you. But during all that time that you've been eating all that junk, the toxic overload in the whole entire body has gotten worse. And then as that gets worse, then your body starts to, all the organs and glands start to shut down. And since the endocrine system is the system of function or part of it, it's like a husband and wife. It's a marriage between hormones and nerve supply, and you gotta balance both of those. And that's again with a good diet. It's the only way you're gonna be able to do it, and with the right supplementation. There are a series of supplements that help repair and rebuild glands and organs in the body. And as long as you can basically take those supplements and a good diet and again, take care of yourself physically from exercise, then you're going to start to see a change with your body. But if you don't, it's just going to continue on breaking down. So people start going, like we talked about, women with menopause. Men go through the same thing. It's called menopause. No, I'm serious. You get these guys that were jocks when they were younger, and then they get married, they have kids, they really go to the gym every once in a while. They're trying to raise a family. They're trying to make a successful life, and they stop their exercise. They eat crazy lunches because if they're dealing with business, that's what they might have to do that. Alter their diet, and then within 5 or 10 years, they're walking around with breasts where their pecs used to be. So, and they see the changes in their body. They see that's pretty much the way it happens. So, you start going through a lifestyle change, and realize it, and that then changes your whole body completely. So when you're in your 40s and 50s, again, going through it, which was, great for me because in hindsight, you see all these things. You start to see guys in their 40s and 50s having problems with blood pressure, having problems with this and that and this and that. And then by the time they're in their 50s to 60s, they're going in for open heart surgery. They're having really pretty intense procedures being done. And then 60 and 70, it could be a nightmare real fast, real quick. And then by 70 to 80, it's another tough road. So if you start to really focus on the importance of taking care of your health and not allowing somebody to do it for you, but really systematically figuring out what you should be eating, what you should be doing as far as physical stuff for your body, and what kind of supplements you should be taking would be great. If you start doing that, you start to see the changes in your body, and it would be something that you would love, because that's where people get very frustrated. They're very frustrated with their bodies. Everybody do that now. So,
And you've talked about different hormone-related body shapes. So,
right.
for example, like women with wide hips or men with a beer belly or pear-shaped weight gain. So, how do these body types reveal which glands or adrenals or ovaries or liver might be out of balance?
It's just by looking at them and just by just and seeing over the years that, this particular patient has ovarian problems and that's the way they're going to look. Or you get the typical guy with the beer belly or with the woman with the beer belly. It's not necessarily because they drink a lot of beer, but that situation basically has a big impact on body shape. So, and unless you start to get, let's say, if the problem is with drinking a lot of alcohol, if you can help detoxify and cleanse the liver, which may take months to years, based on how bad you've been treating the liver, you can start to really alter your body shape again back into normal, because that belly will start to dissipate, go away. And the same thing with ovarian problems. And you'll see it. You'll see it with, certain women. They'll say, my upper body's fine. My lower body's really heavy compared to my upper body. What should I do to basically, correct that? One of the things you want to look at, like I said, is hormonal imbalance. And the second thing is okay, let's make sure you're on a good nutrition program. And then thirdly, let's make sure that you're doing exercises that are going to help elongate and slim and trim those areas that you feel like, bigger in proportion to the rest of your body. So.
So, what are the most common hormonal imbalances that you see in men and women today? And where are these issues showing up earlier and more frequently than before?
Oh, diabetes is a big one. With the insulin today, if you just look at the statistics, I don't have them off the top of my head, but there's tons of people on all kinds of diabetic medications. And that's one of the reasons why people are getting more obese, because by taking the medications, a lot of them lead to, like, let's say, excessive weight gain. The new ones right now that they're using to basically lose weight are new types of products, diabetic products that have come out that tend to, like, get you to drop weight, reduce your appetite, and things like that. And they're going to go by the wayside too, because they're going to start causing all kinds of other health issues with women or men who are taking it. And it's just like everything else. I've watched it since the 60s. Back in the 60s, they had some kind of the fad diets, not too many of them. But back then it was just, taking some, a weight control pill. And that was it. And then now they're like, really getting up into taking pharmaceutical stuff, and it's going to just get worse again. So that's a big one. Thyroid with women, that's a big one. And the minute they see like any kind of a weakness with the thyroid, they want to put you on thyroid medication. And then it's like, okay, trying to find the right medication, the right dosage, and so you can kind of feel, good again. But a lot of women have, problems with their thyroid. They complain about their hair, thinning out. They're complaining about, they have no energy. They can't sleep. And so these hormones really, do the trick. They definitely work, when you can get instant success and instant relief, from that. But that's what it just is. It's just instant relief. It's not going to correct the problem. It's going to just allow you to kind of function better with it. With the men today, it's testosterone. Well, let's put it this way. When I was into bodybuilding back in the 80s, it was growing and growing and growing and growing, because you couldn't, win a show without, doing testosterone and about 3 or 4 other drugs. And to me, it was like, I didn't want to do that, because it was a situation where, I knew what I'm telling you right now is that, I know it would take my testicles and basically shrink them, because that's what it did. I had one of my friends, his name is John Defendis. He's a professional bodybuilder, and he was a phenomenal bodybuilder. And I remember when he had gotten busted for drugs. Okay, they were kind of coming in from France or something, but he got into a lot of trouble. Just to make a long story short, he had to totally go off the steroids. Totally. He lost all his strength. He lost his sex drive. He lost everything. And it was like, and depression, he said, forget about it. And it was, here's a guy that just built his whole reputation on this stuff. And, I had to like kind of give it up, so, but there was a whole situation where this was going back in the, I'd say, I think it was the early 90s. And so it was a while ago, but, it just goes to show you, like, even back then, and guys were just taking drugs to, like, take them. I want to get bigger and stronger. It's like, what do you want to destroy your body for? I don't care. It's like, you don't care. And so we posed the question. The psychologist posed the question. We had about 80 bodybuilders in the room. And he had said to him, he says, if I could get you to win the Mr. Olympia by the time you're 25 or 30, okay, you just won it once, and that's it, but you'd have to be dead by 50, would you do it? Just about all of them raised their hand. They didn't care about, like, the longevity. I just want to be Mr. Olympia, win 50,000, because that's what the prize money was. And that's my life. In a nutshell. So it's kind of like you have a lot of that stuff out there, and now it's even getting it's worse, because the kids are getting more and more, and they're getting really good types of drugs, and the types of drugs that they're getting with the more designer drugs compared to years ago. So and probably a lot more deadly. And yeah, I watch it too with a lot of the bodybuilders. They diet. These are top guys. They die in their 30s, 40s, 50s.
Yeah.
Heart disease, cancer, kidney disease. That's not that you want that as a healthy lifestyle. But the same is true with the other hormones. But those are the big ones. Those are the real big ones that you see. This is the hormone replacement. It's the insulin and the thyroid. And then it's just some other minor things.
And I know you often say test, don't guess. So how does blood chemistry testing help you identify which glands or hormones are malfunctioning and personalize treatment for each patient?
Yeah, what we normally do, we run I think it's around 75 tests. And
Oh,
with
wow.
those 75 tests, you get all kinds of different panels, some for heart, some for kidney, some for diabetes, and just a general chem screen. But then we look for thyroid. We also look for the hormones, female and male hormones. So we look at the FSH, the LH, the progesterone, estrogen, estradiol, and you start to see like which ones are kind of like out of range. Because they set up a range with the lab. And the problem with the lab ranges, Layla, is that they're usually, kind of too wide. They play around with the ranges. They manipulate them in a lot of different ways, which I can't even go into right now. But if you look at all the different ranges, you can start to see if it's the FSHs, or it could be a pituitary problem. You see if it's, if it's that pituitary problem is affecting something else. You start to say, okay, these are the organs and glands of the week. These are the ones that we want to support. So then we utilize certain supplements, mostly in form of tissue concentrates. They're the only supplements that repair and rebuild glands. So if it's a problem with the pituitary or a problem with hypothalamus, glands that people exist in their body, we can help support that too as well. And there are different types of techniques that we utilize, but from a nutritional perspective, that's what you want to do. You want to just get them on a good diet that where they're sleeping better, they feel better, they feel stronger, they have energy. That's what they want. People want to just feel like they want to feel good. They know what they know intuitively what they're supposed to feel like, and they don't feel that way. They're looking for answers. And so the whole thing was with me. It was like, look, we're all different diseases. There's three answers: chemical, physical, mental, emotional. I mean, if you have a toothache, hangnail, or cancer, it doesn't matter. It's one of those three. Actually, it's all three of those three. But different ones, different people have, some of it is more mental, some more physical, some more chemical, and some have a combination of both physical as, bad portions of their own. So that's what we utilize a blood test, and the blood test also tells me what kind of food you should be eating.
Mhm.
And so, this is what I always do too. I always say to the patient, I say, what do you really love to eat? And then they'll tell me what they love to eat. And they'll tell me, well, I don't eat it because my doctor said this is not good for my cholesterol. It's not good for this. And I look at their diet, what they're supposed to eat, and I look at what they really like to eat. And as long as it's a good match, that's what I want them to eat. I want them to eat foods that they enjoy eating. I want them to eat foods that are wholesome. I want them to eat foods that are simple to prepare, not like you have to be a chef and all the rest of that stuff. And I just want simple and basic, but they're just always tasting good, and you never feel like you're on a diet. And that's the goal. And as long as you like the people that say, I like steak or I like this, they intuitively, that's what they should be eating. And then if you look at the blood test results, then that'll clarify, yes, they should be eating, let's say, a ketogenic diet. And then, yes, they should be doing this, because we utilize 15 tests just to determine what kind of a nutritional profile you should be. If you should be a ketogenic, paleo, or whatever, because that's what I was doing way back in the early 80s, late 70s. That's how we determined, diet. And I'd learned about blood chemistry analysis around that time and realized that's the best way to do it. Why play around with anything else than look at your blood chemistry? It's a biochemical blueprint of you. So if we look at that blueprint, we know what we want to do. You're going to start seeing results with your nutrition. And this is one of the biggest problems I see with patients or with people. It's like they don't know. Even though they say they got a good diet, they don't know if they have a good diet. Because the first question I ask them is, "What'd you eat 2 weeks ago on Saturday?" And they go, "I don't know." Was
Mhm.
that a trick question or something? I said, "No, you got to write everything down for years and to see exactly, what you do and how you feel and what's going on. This is not like something that you just do once or twice and then forget about it. This is an ongoing process." And so most people don't do that. They'll keep
Absolutely.
keep better care of their gerbil, okay, than their overall health. So
Mhm. Yeah, no, for sure. And I know there's so many apps that do make that easier now. You could just, there's some I think you take pictures of it and log it, and
no,
people can all
I
do
did
things.
everything longhand.
Mhm.
Everything, writing out the calories, estimating the fat, the protein, the carbohydrate, how many sets I did, the weights, and all the rest. And you do that, and after a while, you know just how you feel and what's going on. Especially when I was into weight training, it was like when you go from 190 to like 210 in like 5 or 6 months, you're doing something right.
Right.
I mean, you got to look, you want to put on 20 pounds of fat. But if you're getting stronger and you're starting to see that going on, the weight's more muscle mass than anything else. So,
Mhm. Absolutely. And having that record, like you said, going from 190 to 210, for example, just having that record to be able to track and look back and say,
mm,
okay, where were the changes, if there were any, and how to, really have that, I guess, record was super helpful. And it's also helpful in terms of even like for doctors and health, if they're asking you, what's your, like, for example, what do you usually eat, or, what's your routine and that. And sometimes, like you said, you'll forget what you had last Saturday. So it is important
there's
to,
no way, yeah, unless you're keeping track, you don't know. I mean, I still
I
do it.
forgot what I had yesterday,
No,
you know?
no, a lot of times, even when I'm writing things down, if I like, okay, what did I have yesterday afternoon? It's like today, it's like, what did I have? And so you forget it that quick. I mean, a few seconds later, I know what I did, uh, but my diet's always like, really consistent. It's not, doesn't fluctuate.
Mhm.
So, and just so I just know like what to do to drop weight, what to do to gain weight. And that's a big issue with a lot of people. And this is a way to like just learn how to do it and you don't have to worry about it anymore. So, you don't have to worry about you're too thin, you're too heavy, you're too this, you're too that. You just know what to do to basically make the changes. So,
Absolutely. And you've said that true healing comes from rebuilding the glands and helping the body make its own hormones rather
yeah.
than relying on artificial replacement. So, how do nutrition, supplements, and functional medicine support that natural process?
Okay. Well, what happens is that they had, there's tons of studies that were done before this on glandular therapy. It goes back into like before Christ times, where they would use different glands and organs to heal the body. So, if you had a problem with your lungs, they would give you lung tissue from either a cow, okay, or a pig, and they would give you that tissue, and they would, desiccate it, dry it up, and have you eat it or have you eat the raw liver. It's just pretty disgusting. But that's what they would do. The same thing with the lungs, and the same thing with the pineal and the pituitary. So this is going back into the 1800s when they would do this. They called it glandular therapy, and so they would give the gland to the the person, and it would help regenerate that gland in that particular person. They do it today, like they call it sweetbreads. It's thymus tissue for the thymus, and there are people that do eat liver, okay, and there are people that do eat spleen and things like that. They have it now in pill form. Well, so what you do is you just take it and you just take in the gland itself. Plus they utilize certain vitamins and minerals with that gland to either help the body absorb it better, but also if the body or the gland needs it to help to produce the hormone and the enzyme or the antibody. So it's kind of it's a really nice process because you can start to see if the gland's functioning better by looking at follow-up blood tests. And if they're doing better and better and better, and the patient's experiencing better health, then that's what you're looking to do. So when I was kind of, let's say, involved with what they call glandular therapy, I went back. That was back in the 1970s. Like I said, nobody was using it. And today, most of the time, if you talk to patients, they don't. They'll take vitamins, they'll take minerals, they'll take homeopathic remedies, they'll take herbs, but they won't take, they don't even know anything about glandular. And so tissue concentrates, and they're the things that basically are the only things that repair and rebuild glands and organs. So I've been, taking those for like, decades. So yeah, since well, I started probably back in late 70s, early 80s. So, but it was kind of, just good information to know and to realize. And so over the years and decades, I've helped so many patients, with the blood chemistry analysis, trying to figure out like, what's going on with their diabetes or their digestive problems or gallbladder problem, or let's say if they had, problems with their appendix, small intestines, large intestines, stomach. You start treating these things with the right nutrition, and the patients respond.
Mhm. And then I know you also recommend retesting after a few months of treatment.
Right.
So, what kinds of changes do patients usually see, both in their blood work and in how they feel on a day-to-day basis?
So, okay, I'll give you an example. The last one I just did was a woman. She's in her 50s, really in good shape. And she was coming in, and we checked her. It was like 9 months ago. And she had a problem with her thyroid. It was very, very weak. And so we changed the diet, and she started and gave her the supplements. We have different supplements to help to, strengthen the thyroid itself and the pituitary and the hypothalamus, because they're involved with thyroid production or of the different hormones. So she went 9 months, and between that time, I treated her a few times with a back or whatever. And so it was about a month ago. So she had come in, let's do a follow up. And she came in, and just to give you an example, her thyroid T4 rating was at the time when she first came in, is 4.5 is like considered the low range. She was three something, 3. So when she did the blood test again, the range goes from 4.5 to 12. Okay. She comes in and she's like at 9. So it was like super hot. And she was feeling good. She wasn't feeling bad. In fact, a week or 2 weeks before that, she lost her dad. And so she was underneath some duress too. But the thyroid came up where I said, okay, the supplements they gave her, I said, let's cut it back a little bit. But she's going up pretty good. But she felt it right away. We also changed her diet. That was another thing too. She was like one of these, I work out 6 days a week, has a nice body. For a 50-year-old, you wouldn't believe it. And then you'd say to yourself, but she's tired. She's kind of run down. And then when I'm looking at her and what she's eating, she just was draining her body too as well. And
Well,
so, but she started to eat more protein, and started taking the supplements, and like an instantaneous, it was like within a month or so,
wow.
better. So, but like I said, it was 9 months, but each person is a little bit different. But the thing I like about my blood work is it's a real complete blood test. And the good thing is that if you have it done every year or 2 years, Layla, it's kind of like a roadmap to like where you are and where you're going. And if you're on the right path, you're gonna be going in a good positive direction as far as your overall health is going. But you can see, if you're doing this, if you're looking at your insulin levels, if they get higher or lower, you see it right away. It's not like it's not there. And that's the body telling you specifically what's going on. And so the better you can kind of keep that in balance. The same thing with the tests that are utilized for determining what you should be eating. You have your sodium, chloride, potassium, cholesterol, triglycerides, calcium, phosphorus. And so we look at all of those to figure out what you should be eating. Then we tell you this is the way you should eat. And you say, I love those things. And it's like, okay, this is a match made in heaven. And now let's give you some kind of like, baselines that you follow or guidelines. This is how much protein you should be taking in. This is the kinds of protein you should be taking in. And you help pick the protein. And you literally like figure out what you like with your diet. So it's like, to me, it's, I mean, any night, it's just something a little bit different, but it's like fish, chicken, steak, pork, veal. It could be anything, pasta. I eat everything, but I know how much that I want to eat. I'm not going to sit down and eat a pound of pasta. Okay. But I'm going to have pasta. I'm going to have bread. I have bread all the time. I have all, things that I love to eat. I enjoy eating. I love eggs. I cannot not eat eggs. Okay. And so everything that we like to eat, that's what we usually eat on a daily basis. So it's not that I feel like, I'm deprived of anything. I mean, I'll have some cake and cookies, but that's not like something and if I do, it's going to be like a piece or like a cookie or something. It's not like I don't need to eat all of that stuff. And, during the holidays, I'll go a little wild like anybody else, but it's not like, something that I have to do all the time. It's something that's
Like in moderation, right? Like
ex-
having a little bit, yeah.
exactly.
It's not part of your everyday, but you could definitely have some and indulge at some point, but just not on a regular basis. Kind of having the like you said, knowing what you like and just having that kind of routine of it being, you know, like over and over again, kind of repetitive.
Yeah.
Like you kind of have the same things, but you could tweak them and change them a little and then kind of stick to those solids in
Well,
a way.
a lot, I'll give you an example I've learned through the decades is that a lot of people confuse fat with the taste of sweet. So when they say to people, they go, "Oh, I have a sugar, craving." They say, "What do you mean sugar craving?" I still go, "Well, I like cake. I like cookies. I said, "That's not sugar. That's fat." And they go, "What
Mhm.
do you mean fat?" I said, "If you look at a cookie, the amount of calories that come from fat in a cookie is about 2/3. And they said fat tastes sweet. So that's why you want it. And if you have more fat in your diet from, let's say, meat or butter or cheese and stuff like that, your cravings for the chocolate and stuff will go down because you're getting your fat. You won't be craving it because you're eating it every day. So, and so these are things, if you're writing all these things down over time, you'll gain so much knowledge from that you don't need to like worry about, okay, this guy says this is good and that's bad and that's bad and that's good. No, you'll know exactly what to do. I'm eating
Mhm.
it.
Absolutely. And when talking about, hormones and the influence that they have on different parts of the body and things like that, but I know you mentioned that hormones influence more than just metabolism.
Right.
So how do these imbalances ripple through the other sides of the triune, the physical and mental, emotional pillars?
Well, yeah, because once you start to develop like a lot of these hormonal imbalances, like we said, it's going to impact your sleep, impact your thought process. You'll start to like where things at one point like really were meaningful to you and now are meaningless to you. And you lost that get up and go or the drive to do certain things. And so depending on the hormones that you're talking about, it's going to impact that too. We also talked about how, hormones will impact your body shape. So you'll start to, see that, kind of coming into bloom. And then not only that, you'll start to be able to not be able to have problems with, you will have problems with your weight. But if you look at what the things that the endocrine system does, it's necessary for reproduction. It's necessary to repair and rebuild the whole entire body. It's necessary, to basically carry out all bodily functions, and it's necessary for your energy. So with all those things that it does, if you and it's not just, I just named some hormones. There's the hormones are produced. Here's an interesting thing, and I'm glad we're just going to bring this up. There's three sources of all hormones. Okay, one source is something called cholesterol. That's the first source of hormones. That's your sex hormones. Okay. And so by them reducing the cholesterol levels over the last 45 years, they've impacted hormonal levels just by doing that to a degree. And not they thought it was in the guys to control heart disease, but it didn't. Heart disease is still the number one killer today in the United States.
Mm.
And there's millions upon millions upon millions of people utilizing statins. So it basically, creates, that kind of a situation too, as well. So when you start looking at all the different things that it can basically, kind of cause and problems that it can create, that's one. So Also, people don't realize that cholesterol is necessary for phospholipid production, which basically surrounds your brain and prevents it from short-circuiting, which is what's now starting to drive a lot of dementia people, because they've been on statins and their brain starts to, demyelinate, which is that term for just losing fat, because they're not taking in the cholesterol, and the body's kind of like prevented from producing cholesterol from the statins. So you have that going on. And then on top of that, the next thing that basically hormones are produced by is something called tyrosine, which is an amino acid. And that produces your epinephrine, norepinephrine, thyroxine, thyroid. But then the third group of things that basically make up the endocrine system is like there's 400 different hormones. And they're made up of what they call peptides. And peptides are just small, they're fragments of basically protein, okay, or hormone. So it's like, you might have the fragment of a particular group that basically could produce this hormone. Because as long as you just have a fragment of that hormone or a portion of it, the body can repair and rebuild and create a new one. So those are the three areas that you basically get that in. And your peptides are basically proteins. So I just told you, people are deficient in protein. They've been deficient in cholesterol because the whole science of nutrition is based on don't eat cholesterol. You don't need cholesterol, you don't eat protein. Or you reduce your protein because God, in his infinite or her infinite wisdom, basically said, no, I'm going to make protein, but I'm going to make it with fat. Protein's going to be the bricks, fat's going to be the mortar. And we're going to basically create different proteins. So the body can create, there's only 20 different amino acids. But the body can create thousands upon thousands upon thousands of different proteins. That's why there's nobody that looks the same. Yeah, I mean, they have liver, they have a heart and stuff, but it's totally different for everybody. Everybody's just unique. It's just your perfect blueprint. But it comes from those hormones, and it comes from the amount of protein you've been taking in and the amount of fat. If you can do those things on a consistent basis and figure out like, okay, this is how much protein I need, this is how much fat I need, then you start to see even bodily changes. So, but it can, the impact is just on, I don't know, from your endocrine system, it can impact your immune system, it can impact your digestive system, which it basically does, and just any system in the body is really, lymphatic system is impacted by it. So it's far-reaching effects, and because each hormone, and the other thing too is hormones work in perfect unison. Like this hormone will produce, let's say, increase the production of this hormone. The increased production of this hormone will slow down this other hormone. That'll increase the production of another hormone. And it's this whole basic, circuitry that basically is involved with like hundreds of different hormones, and they have to be there and being produced at that particular time. And so the other thing too is, by the way, and you'll know this more because you're a woman, is that, hormonal levels through they have different cycles. And so sometimes people say, the winter time is like the best time of the year when I feel the greatest. And a woman will be like, every month they should have the cycle. At certain times of that cycle, you might feel great. At certain times of that cycle, you might feel like crap. And it's cyclic. It's going to just keep on going that way. So then when it does that, you can see how it impacts your emotions as well. And then also you get the bloating or whatever and some weight gain and things like that. So you can see how just those slight changes, with the estrogen, progesterone, testosterone, and estradiol levels can literally, change your whole emotional state. So,
Absolutely.
yeah.
Absolutely. And let's say for someone who's listening now who may feel like their hormones might be off, they feel something's off. What's one simple step that they can take to start restoring their natural balance?
I would say just make sure you take a hormonal test to see what's going on. And then from there, you can get a good idea as to what's happening. Because it may not even be hormonal. maybe said, and I shouldn't say may not be. Might not be that set of hormones that's creating the problem. But yeah, that would be because again, test, don't guess. It's like when I first started getting involved with nutrition, my biggest thing was like, how do I determine like what kind of diet a person needs? Because it's not like here, it's for me. I'm going to be dealing with diabetics. I'm going to be dealing with people that have heart disease. I'm going to be dealing with people with obesity. I'm going to be dealing with people that have all different kinds of ailments. And I can't be basically putting same people on everybody in the same diet. That would be ludicrous because we're all different. And then not only that, finding the right diet, but then, okay, how do I then assess like what glands or organs are weak? A person comes in, they has COPD. I know it's their lungs, but then was there anything prior to that that created that lung situation? I mean, besides being a smoker or a non-smoker. So you have to look at those things too as well. Or a problem coming in with a patient coming in with a urinary problem, a urinary tract infection. So it would be like, oh, I think I got a UTI. It's like, okay, we'll do a blood test, do a urine analysis, and see. A lot of times there's not even a positive UTI, but they'll give them some kind of antibiotic anyway. Take it just why? Well, just in case. In case of what? He said there was no bacteria. Well, just in case. Don't make me laugh. I hear some stories. It's like I can't believe it, but anyway, that's hormones like we spoke about have far-reaching effects on the body. And like I said, from the mental, emotional, because we just talked about that. If you can't get sleep, you're a wreck. You can see during your 30-day cycle with the menstrual cycle, how it can really impact how you feel, emotional states on any given day. It can make your weight fluctuate too. So, and then physically, if you have bad menstrual cramps, that's a hard procedure to go through. So it has a, not an impact on everything. And you don't realize it. Like I said, sometimes you just, it's like, you're depressed, or you're down, or you just lose your drive, and you go, no, what's bothering me? It's nothing's really like I can say that, yes, it made a total difference than what it was. Instead, now it's because of hormone changes and shifts, even crazy physiologic storms that can impact chemistry of your body, affect your mental emotional state. That's what you want to do. Take care of that. So.
No, absolutely. And no, I think that this was definitely a powerful look at how hormones influence every part of our lives, our energy, our focus, weight, and even our outlook. So, Dr. Cima, thank you so much. Thanks for reminding us that balance isn't found in a quick fix.
No.
It's created when nutrition, detox, and the triune of health work together.
Absolutely.
Be sure to follow the show, everyone, so you never miss on an episode. more laughs with Dr. Cima. And until then, here is to Health Without Limits. Thank you so much, Dr. Cima.
Thank you, Layla. Have a great day.
You too.